Everybody ready? Welcome. All right, so I am Courtney Ford. I'm the practice manager of Growing Bones Pediatric and Neuromuscular Orthopedic Institute. I want to welcome you to our discussion today on toe walking and the benefits of therapy. I am joined by board certified pediatric orthopedic surgeon, Dr. Justin Connor, and pediatric physical therapist with Kids in Motion, pediatric therapy in Los Angeles, California, Michelle Flores. Welcome and hello. Thanks for joining us.
Hi.
So, Dr. Connor, I'm going to turn it over to you first, just to tell us all a little bit about what toe walking is, how does this come about, and what are kind of the long-term effects of toe walking if not treated?
Sure. Well, staying first, I love addressing this topic. This is one of the common reasons I think that I'll see referrals from both parents who are concerned and physicians who refer parents who have children with toe walking. So toe walking, it is as if it sounds. So it's kids who are walking on their toes. I mean, it's pretty self-explanatory in that respect. And generally they're not putting their heels down. So normally when we walk with a heel toe gait pattern. We put our heel down first, and then we roll over our foot, and then we push off on our toes to push us forward. And kids who toe walk, they basically walk constantly on their toes. And developmentally, it's actually fairly appropriate when they're young, as babies, and they're learning how to walk. But usually, a lot of kids will develop a natural pattern of a heel toe walk somewhere around 18 months or so. And in general, we expect that they're fairly flat by the time they're 2 years of age. And so the kids who are continuing to walk on their toes, are often seen by parents and grandparents and doctors to wonder why they're still doing that. I will also say, by definition, what isn't toe walking? And toe walking specifically is in kids who do not have a reason to walk on their toes. And some of those reasons to walk on their toes, and many of the reasons that I'll rule out when I see them, is to make sure it's not related to a nerve disorder. So that it's not related to something like cerebral palsy or a tightness of the muscles that they were born with, or that was hereditary, right? So there could be a nerve reason why they're walking on their toes. And of course, if there is another reason, then we should address that reason to deal with that. Making sure it's not a muscle reason. So there are kids who were walking flat, but then they start to rise up on their toes. And that can be muscle conditions like muscular dystrophy or other muscle related disorders. Or there could be some behavioral reasons. Autism and spectrum disorders are also associated with as well. And some developmental delays may be associated. So toe walking is not related to these things. This is an otherwise typical child who's walking on their toes. And so they usually are getting around fairly well, are keeping up with their peers. And, it's often a social concern for parents and grandparents. And then, of course, in the long term, people want to know, is this going to be an issue? And so that's where a little bit of the debate is. But we do see that kids who toe walk, they can have some issues with pain, whether it's in associated joints, knees and ankles and those types of things. They can have decreased balance, and they can have decreased endurance when they're walking. And then as they age into adulthood, they can be adults who walk with a little pep in their step, right? They have a little bit of a springy walk to them, and sometimes that can cause concerns socially and cosmetically among patients as they age.
Great, thank you for that overview and description for the toe walking. Michelle, can you tell us a little bit about how the pediatric physical therapist interacts with a toe walking patient?
Yeah, so when a family comes in to see a pediatric PT, what the pediatric PT is going to do is they're going to go through a history, kind of figure out when they started toe walking, and then kind of get an idea of like how the patient moves, any possible reasons for like sensory reasons as to why they're toe walking. And then they'll get into the meat of it and really start working on some exercises on how we can fix this toe walking. So oftentimes we'll start out with the calf stretches, which because oftentimes the muscle that is causing them to walk on their toes is a little bit tighter. And so we'll have them stretch out so that they have a little bit more bend in their foot. And so that's typically where we start. And then we give some strengthening exercises to make sure that they can use that range of motion. Because oftentimes when like a muscle is tight, the opposite muscle is weak. And so we're going to work on stretching out the tight muscle and then strengthening the weaker muscle.
Okay, and you've developed 2 separate programs for toe walking, and both of those are going to be available on our website, growing-bones.com. There's also the link for that is going to be posted in the comments. Could you tell us a little bit about the difference between the basic stretching exercise program that you're having available and then the more advanced strengthening routine?
Sure. So the first exercise routine that I have is about stretching. So a lot of it is going to be more about static holds, getting the range of motion in the calf muscles, in the hamstring muscles, and just overall in like the lower extremities. So we'll have a lot of the pictures will kind of show like the parent is like moving them into different ranges of motions, and you're going to have them hold it. So the reason why I'm having them start out with that is because to have the range of motion in order to strengthen the muscles the opposite way, they need to have the range of motion in that way. So we're going to work on that flexibility first. And then the second exercise routine that I have for you guys is a strengthening routine. So that's kind of working on the ankle dorsiflexors, on working on the core muscles, and just general lower extremity muscles. So we have a lot of like animal walks, a lot of squatting, and like a lot of like climbing up and down ladders and stairs.
Yeah, the animal walks look most fun to me, and I do want to give you a big kudos for the way that you have a make it fun kind of feature for each of the exercises. It's really important to get the kids, enjoying the routines that they're doing in order to make some progress. And you give us really tangible ways to do that with these exercises. So I know they're going to be appreciated by parents and therapists as well. Dr. Connor, can you tell me a little bit about, I think you mentioned this in your introduction, but a little bit more about when a parent should be concerned and contact an orthopedic specialist? How long should I notice my child toe walking before I seek help?
Sure. And so the classic answer is going to be that a child should stop walking on their toes by 2 years of age. And that's sort of your classic book answer. And many times, this will start off with your pediatrician. And so your pediatrician has a good sense of comfort level with many of these things, because it's a fairly common concern. It's estimated that about 5% of kids are going to walk on their toes past 2 years of age. So it's not an uncommon thing. And so often the pediatrician will observe it for a little while longer. So 2 is just sort of the year that piques our interest. And then usually between about 2 and 3 years of age, if it's still occurring, we'll often refer to make sure, once again, there's not something else that's going on, one of those neurological or muscle conditions. And then I think this is also where if the child is typical in other ways, that it also depends on the comfort of the parent, sometimes the grandparent. Is this causing any concern around school circles or social circles as well, or anxiety, and how aggressive the parent wants to be, because there is also a family relationship that has been identified for some kids where parents have walked on their toes, or aunts and uncles have walked on their toes, and it may not be a big deal for the family. And long-term research really, is unconclusive as to, is it truly going to be a problem in the long term for them? And so some parents have a more comfort level, but usually you at least want to have that assessment. And then, if we're initiating treatment, we're usually initiating treatment, between that 2nd and 3rd year. And this is one of those diagnoses that really is it's really awesome to sort of have Michelle here, because this sort of works really hand in hand, where I'm sort of ruling out things, but then she's able to give them really simple things for parents to do, especially in these younger kids, that a lot of times they can make it fun at home and do things at home, but then there's also techniques that she can do if she sees that it's getting out of that it's worsening, or that it's progressing, or that it's not improving. And so the therapist will often see them a little bit more frequently than I will, and they'll alert me and say, there's something a little bit different about this child, and we'll sort of work on that together. So I'd say, between 2 and 3 years of age, I think we should at least have an assessment by a medical professional.
Okay, great, thank you. And this is a question for either of you, and maybe both of you. What are the sensory reasons for toe walking?
Yeah, so I can give a little bit of input on that. So in terms of like sensory input, there are three main systems that we work at. So the first one is tactile. So that's the system that lets us understand touch. Then there's the vestibular system, which controls our sense of gravity and movement. And then there's the proprioceptive system, which provides us information about the speed of muscle stretch and perception of the body in space. So I kind of like to think of it as like kids can look at all three of these systems, and they can either be sensory seeking, so like they seek that input, or they are sensory avoiding, so they're avoiding that input. So based off of those things, like those sensory, the way that they interact with those sensory systems can manifest in toe walking. So for instance, like if your child is seeking proprioceptive input, they have that kind of bounce in their step when like that Justin, like that Dr. Connor was talking about. And then, or if like your child is kind of avoiding tactile input, they'll pull away from the sensation of the ground. So then they're like toe walking as they're moving.
Okay, great. And Dr. Connor, do you have anything to add there about sensory or other things that might influence toe walking?
Well, yes, I think in terms of sensory, and we haven't really talked about treatment options yet, but children who have sensory component, I will say they can be a little bit more challenging sometimes to maintain a result, and because it's there's an external drive, right? So it's not simply sort of a coordination and a pattern of walking, but there may be this other sensory seeking or sensory avoiding component, so that even once you bring kids down flat by various measures, occasionally there's this drive to go back up, and their recurrence rates of walking on their toes are higher. They also tend to walk a little bit taller as well on their toes, because there's this external component as well.
Okay. So tell me a little bit about treatment options. You mentioned, we haven't talked about that yet. Let's talk about that now, right? And aside from the stretching and the strengthening exercises that can be done at home or with a physical therapist, what are some other treatment options?
Sure. So I will say, oh, no, go ahead.
Yeah. So I guess like it really depends on what your child is seeking the sensory input or avoiding sensory input. So if you notice that you have like this is where like I feel like a pediatric PT can like really really hone in on like what exactly it is, because it's kind of difficult for you to tell just based off of like watching them toe walk. Like I think that it's helpful to see like a pediatric PT, because then they can like really like say like, okay, like this is what they're avoiding right here, and this is where we treat it. But I guess like in the examples that I kind of gave, if they are pulling away from the ground when they like toe walk, if they have a history of like being like pretty like tactile avoidant and like they don't really like touch, I think somewhere to start is like having them work on kind of like massaging them. I like to do like a lot of like having like lotion on and like doing kind of like desensitization, just to help with that like sensory avoidant pattern. With like that proprioceptive, if they're like seeking that like bouncing sensation, I will have them like, I will have them on like more of a program of like bouncing. And so like having them like get a little like yoga ball and like have them like bounce in their seat while they're like doing their homework, things like that, so that they're getting that input elsewhere so that they don't have to do it when they're toe walking.
Absolutely. Dr. Connor, did you have something to add to that, treatment options?
Yeah, and I think of it sort of holistically from, from really birth until teenagers or adults, because a lot depends on age and a lot depends on your flexibility. And so, especially very early on when kids are walking, even if they're less than 2 and a parent, is concerned, there's little things you can do, right? So you can put them in, and these are sort of not, true medical treatments, but high top shoes or boots, they make it a little bit harder to walk on your toes because they go above the ankle. They're not as flexible. You do little games with the kids and those types of things at home. And then, I think when we sort of move into the treatment realm, I'll say at every level, the physical therapist is the foundation, or flexibility, mobility, strength, and therapy is often the foundation, right? So usually when they're in that 2 to 3 year old range, or in that younger range, they're still flexible, and right, so they still are able to come down on their heels when they're prompted, but they just tend to walk on their toes. And so that's where you can do things like introducing games or a reward system, or I think they have these little things called squeakers that you can sort of put into their shoes that sort of squeak and give a little bit of auditory feedback, so they can like make a bunch of noise walking down the hall when their heels are on the ground. You can do things like making games like that to try to sort of retrain and also all the while maintaining flexibility. And then, I'd say a step after that is whether you want to do something a little bit more active, such as bracing. So bracing, it can be bracing during the day, where it's bracing that actually physically stops them from going up on their toes. And there's braces that are meant to go into regular shoes that stop you from going on your toes, or discourage you from going on your toes. And then in children who may not tolerate day bracing or may have a little bit of flexibility, there are nighttime options as well, to do a little bit of a stretch at night. And so those kids are usually a little bit older. And often parents are wanting to try to get through the bracing options before they're getting into kindergarten and preschool, to try to have them sort of flat before then. And that's sort of the next step. For kids who are a little bit more, so now they're getting older, or they present older, and they may be getting a little bit of tightness in the muscles. And to address that tightness that may not be responding to simply stretching, you can do other things like casting. So that's an option as well. And I'm going from least invasive to most aggressive. And so casting is an option. Obviously, there's the annoyances of casting, but it's relatively well tolerated and fairly effective. There have been studies about Botox injections as well. And then when you physically can't get your feet down, and there's a physical limitation, what we call a contracture in the muscle or the tendon, and that's when we start talking about surgical interventions. Those are usually older children who've been on their toes. They may be 8 to 12 years old, so they're usually physically they can't come down even when prompted, and they can't be stretched, and it's very difficult. And sometimes they're having pain associated with it, or balance issues, or walking concerns. Then those kids are kids who will do surgery, and surgery is very effective. Probably 85% effective. It's very effective, but of course it's surgery. But you physically lengthen the tendons and the muscles to bring the kids down.
Right. At this point, I want to take a little pause and just invite all of those who are watching us on the Facebook Live to post any questions or comments they have in the live chat, so that I can ask those out loud and verbally to Michelle and Dr. Connor. And then, while everybody's typing in the chat box, Michelle or Dr. Connor, do you have anything to add about toe walking that we haven't gone over yet, or just wanted to make a point to explain?
Well, I think toe walking is one of those things that I think creates a lot of anxiety, and it doesn't necessarily need to be that way. And I think that once you're assessed by a medical professional, there's not something that's quote unquote wrong with the child. They're usually very typical children who have normal academics and normal speech, and they play sports and they participate and they do all these different things otherwise. And so I think a lot of people are concerned that there's something insidious that's happening that's causing this, and so the majority of them are not. And there are definite things that can be done, and usually they're very usually surgery is not required. Surgery is the exception, definitely, and it's pretty uncommon that we get that far down the road.
Right. Yeah, when you start to talk about surgery, it seems a little scarier, right? Well, we don't have any questions from the chat box. Jay does say good morning. So good morning, Jay. Nice to have you here. Are there any other thoughts before we wrap up? All right. I want to thank both of you for being here, telling us a lot about ToeWalking. Again, reminder that the link for all the resources, the stretching and the strengthening exercises can be found in the comment box and on our website, growing-bones.com. Follow us on Facebook so that you are aware of our upcoming webinars next month. Thank you so much, everyone.